Decades of health psychology research has found that for patients to make changes to their lifestyle, they first need to perceive a risk in a way that is meaningful to them. So with absolute risk assessments, we actually have a really easy to understand way to convey that risk to patients. Previously, we had to give them lots of numbers from cholesterol test results and blood pressure readings, and that could be really overwhelming for patients considering most Australians actually have low health literacy, which means it's hard for them to understand and act on information about their health. So with absolute risk, we can actually change that into a more meaningful risk format. So how we do that is if we take the example of someone at 18% absolute risk of a heart attack or stroke in the next 5 years, we can convert that into a frequency format. So instead of saying 18%, you can say if there were 100 people like you in the room, 18 of those people would have a heart attack or stroke in the next 5 years. And when you put it in those sort of terms related to an event that's really meaningful to someone like a heart attack, they are more likely to be motivated to make changes to their lifestyle. My take-home message from this webinar is that absolute risk assessment presents an opportunity to communicate risk in a more meaningful way to patients. So instead of bombarding them with all these abstract numbers like cholesterol and blood pressure results, we can convey a more simple message of your risk is 18%, which means out of 100 people like you, there will be 18 heart attacks or strokes in the next 5 years. We can then talk about the benefits of medication and lifestyle in relation to that.